Welcome to SNAP's National Webinar, Student Advocacy, Finding Balance Between Exams and Activism. My name is Roberta Barnes. I am a MSMD student at SUNY Upstate Medical University. Can the other panelists introduce themselves?
Yes, hi, my name is Tina Collins. I am one of the new national organizers for PNHP based here in Chicago.
And my name's Augie Lindmark. I'm a fourth year at the University of Minnesota Medical School and work with SNAP as one of the student board members. Nice to have you all on the call.
Hey, I'm Caitlin. I'm one of the other new organizers at PNHP's national office.
Hi, I'm Frances. I'm a medical student at Tulane University. And yeah, I'm really excited to do this call.
Was my microphone muted when I introduced myself?
Yeah.
Yes, it was.
Okay. I'm Sydney Russell-Lead. I'm an MD MPH candidate at SUNY Upstate in Syracuse.
All right. I think that is everyone. So, keep going. Okay. Can you please describe your experiences in? Sorry, let me get the question. Please describe your experience with advocacy and how you got involved.
Roberta, do you want us to go in order on the panelist list?
Yeah, I guess that would be most convenient.
Okay. So maybe Frances, if you want to start. Frances looks maybe a little frozen, so I can go. My name's Augie Lindmark. As far as kind of experience in advocacy, I think back to undergrad is probably where I first got involved and kind of was introduced. I was studying a virus, HIV, from a biological perspective, but quickly was introduced to kind of the grave limitations of how, or the limitations of science of it's great if you have medical interventions identified, but when there's barriers and stigma and human rights abuses to ensuring treatment is only available to some people in this world and not to others, that was kind of my introduction to advocacy. So I worked with a group called Face AIDS for a little while, and we had a cross-country bike ride called the Ride Against AIDS, where we did a lot of campaigns with state-based AIDS organizations and raised money for partners in health programs in the United States and Rwanda. So I think that was kind of how I first got involved, and then have always kind of had a lens of advocacy through medical school to complement a lot of the biomedicine that we get and the kind of the absence of any sort of structural education or calls to action in medical school. So SNAP has been a central part of that for me.
Frances, are you back? Oh, you're muted.
I guess I'm going to do it.
Is that better? Can you hear me and see me? Okay. My internet gets really bad at night for some reason, so I don't know. I might have to wind up calling it. But anyway, my name is Frances, and I got involved with advocacy when I started medical school. I didn't even really 100% know what advocacy was or what that meant, but I got involved with the American Medical Students Association chapter at my school, and there was a position in the chapter of like advocacy chair. So I was like, all right, sure, that sounds good. And then the timing of that just coincided with Trump getting elected and the efforts to repeal Obamacare. And so it was like all of a sudden I had this role and we had a lot to do. So it was kind of a trial by fire, and we just jumped right in. And that the learning experience there was of the many different varieties of experience that advocacy can take. Like we did direct service type stuff, like trying to sign people up during open enrollment, and we did phone banking and held rallies and fundraisers, and just came at it from a lot of different angles. And then through that, I got involved with the local chapter of the Democratic Socialists of America here, which gave me kind of a vehicle for more like longitudinal organizing outside of the medical school setting. So, yeah,
Okay, I guess I'll go. So I have been politically involved since I was like 15, so I guess 10 years at this point. It was really the context that I went to high school, and pretty much everyone was involved, and activism was a core tenet of the school. So I started with environmentalism and kind of jumped around to a lot of different things: labor rights for immigrants, public housing, prison abolition, racial equity, and health. Kind of all of that has been related to the right to health in some way. So I was interested in public health long before med school. And so now I'm doing single payer on a few different levels with PNHP and also with the state-based organization in New York.
Organizers, if you also wanted to mention how you got involved.
Gina, you want to go first?
Yeah, I'll go first. So thanks so much for having us on the panel, first off. Secondly, yes, similar to our last panelist, I've been politically involved in the city of Chicago since I was 14. And a lot of my organizing work is grassroots organizing work around gun violence prevention and criminal justice reform work. I got into that because I lived and grew up on the west side of Chicago in the Austin community. Austin, for the last few years and just throughout the last decade, has had one of the highest homicide rates in the city of Chicago. And so I've always viewed gun violence as a public health emergency and a health concern. Obviously, the federal government doesn't look at it that way. So yeah, my push has always been how to connect the healthcare community to issues like food deserts, gun violence prevention, and medical deserts that happen to occur in many Black and brown communities across the country. And so now I'm in the fight for single payer and helping to organize doctors and medical students, not just in PNHP, but outside of our network, and particularly continuing with that same goal of looking at gun violence through a public health emergency lens.
That's awesome. Hi, I'm Caitlin Gilbert. I'm also one of the new organizers here, and feeling pretty privileged to be working with someone like Kina, who's done a lot for our city and our country. So pretty stoked. My advocacy started when I started working with kids, which is one of my major passions in addition to environmental justice. I saw those two as the two most vulnerable parts of our community. I worked with kids coaching, and then I also worked at a group home advocating for kids who, whether they were refugees from the Congo or just underserved communities in the United States. I was kind of their group home mom. And then a lot of my legislative background is in environmental justice, so working for an environmental law and policy center, working for Organizing for Action, which used to be Obama for America, you might know it as, working for their climate and environmental justice initiatives. And so I feel really privileged to be able to step into this environment of health justice, just seeing how health is so underserved all across the country. So it's really exciting to be here and talking to you all today.
Okay. The next question, what has been the most effective way to make sure your voice is heard as a busy medical student?
I can rock and roll with that one. I think probably the first piece entering school is I think kind of recognizing the structures that actually don't lend themselves to advocacy as a health professional student, medical student, what have you. So I think kind of the first step for me was recognizing that our voices have value in a system that usually kind of puts medical students and health professional students at the bottom of the totem pole. I think there's this inheritance effect where people say you are the future of this health system. So everybody also kind of looks at you with an optimism. And so I think as we go through school, recognizing we're gonna be pulled in a lot of different ways. We certainly get pulled towards exams. We certainly get pulled towards studying. And I think the most effective way that I made sure my voice has been heard is kind of checking my pulse throughout the years of making sure that every day, every week, every month that I'm somehow blurring the lines and bridging what I'm studying, which can be challenging, of biochemistry, to a systemic action. And the best way to do that is to find a strong, good community of people that are wrestling with those same things as you are diving into content that maybe seems pretty far away from making the large-scale changes that our health system needs right now at a crisis tipping point. Finding your community and then also kind of scheduling how you're taking those steps as an activist and advocate.
So I guess I'll touch on this. So I was thinking about this in kind of two different ways. There's the interpersonal level, which I think Augie did a really good job explaining, and then there's the personal level, how as you as an individual can make sure you're the most effective in whatever you want to do. And for me, the most important thing is reducing the amount of time I spend worrying about things and more time like actually doing stuff. So for me, I find that having like an overarching plan or like really working to identify my own value system lets me kind of always be working towards something that I find is useful without having that decision fatigue or like trying to schedule things. That's especially useful in organizing. If you always have a plan for what comes next, then you don't really have to worry about it as you're doing it. You just do what needs to be done. And then also like thinking about what you're passionate about in a given moment and working on that so things don't feel like a chore is really helpful. And I personally find that if I'm not feeling passionate about anything at all, it's because there's like one stupid task that I really don't want to do. And so I've been putting that off. And if I just do that task, then I'll feel better and I'll like jump back into what I'm doing. Francis, do you want to add anything?
Yeah, I do. Thank you. I was thinking that that I feel like one of the most important ways to make your voice, make sure that your voice is heard, is to really like, I mean, I would second everything that everyone else said also, but to be persistent and to show up and do the work, because I think there's like a lot of organizations that have been fighting these fights for a very, very long time, and the more that we can like really, I think med students have a way of being kind of flaky sometimes, because we are really busy, and so sometimes we're like, I just can't do that. But just showing up and being consistent and being persistent will go a long ways towards making your voice effective. And then also, I would say the most effective way to make sure that I think the most effective way that you can use your voice is to make sure that someone else's story gets heard. So not just like retelling the stories of patients or people that you encounter, but like really finding ways to bring them into the room where decisions get made. Yeah.
There are so many resources available to medical students to do that. And so you can like host an event with like patients telling their stories at your school or that kind of thing, or invite community organizations to events that you know of that are like grand rounds being delivered by faculty that would be of interest and actual practical use to community organizations. You can invite them.
So I want to move on to the next question. What forms of advocacy do you believe have been ineffective in your time as a student activist? What obstacles have you encountered as you have participated in advocacy alongside the additional stressors of life in school?
Yeah, I would like to answer that, Roberta. This is Kina speaking. I would say one of the obstacles is definitely understanding that in organizing work, it's easy for organizers or different advocacy groups to take a kind of elitist perspective on who has the best answer to solving the problem. And the truth, the reason why that's an obstacle, because the truth is that there are several ways to find a solution to many different problems. I think also being young, being Black, being a woman, and standing at the intersections of those discriminations have been obstacles that I've always had to overcome. And I think that the way that I've overcome those is by, like earlier panelists have said, is showing up, being consistent, but also being the best at what I'm doing and encouraging and being a team player and understanding that I have one-dimensional approach of doing something, but it's always better when we are inclusive and intersectional and understanding that other people's perspectives allows us to have more long-lasting and enduring solutions.
Yeah, I'd like to chime in on that as well, because I think Kina hit on some really important points, and one of them being like knowing what you're good at. So, okay, going back, there's advice that I tell my little 5th grade girls in basketball, and I apply it to adults, and I apply it to medical students and to my own life. And I say the 2 keys to life: 1 is remember what you like about yourself, and 2 is to take care of each other. So when we're organizing, it's really, really important to know what our skills are. And it's ineffective to try and be something you're not. So if you're trying to reinvent the wheel and let's say you just stink at tabling, then stop tabling. You have an hour a week. Like, then stop it. It doesn't make sense. And then the second part is to take care of each other. And, you know, at the annual meeting, and we're going to be hearing about this more and more in our political climate, is no matter where you come from or what you look like, constantly be checking your privilege. And what have you inherited being a student or coming from where you come from or anything like that? What is your inheritance, and how can you spread that for other advocates? Because as Kina pointed out, we can't do this alone, and it's important that we help each other out. So remember what you like about yourself and take care of each other.
Absolutely. The worst way as a student advocate or organizer that you can find that will make anything that you do ineffective is by working in silos, right? Like, there's so many ways to collaborate with other people, and it just brings a more richness and a fullness. And I couldn't agree more with what Caitlin just said. That was all great.
Ineffective advocacy would be if you're advocating and everyone else around you is the same profession, looks like you, and has the same life experiences as you, which is, I think y'all hit it on the head, which is very easy to fall into that trap in school because you're surrounded by people all studying the same thing. Granted, we all have varied experiences and what brought us to this space, but yeah.
Yeah, and I would just like to echo what everyone else has already said. Like, teamwork is just, it's really inspiring, and it's really crucial to see something that, like, maybe you could get it done on your own, but it's just so much better when you see everyone come together and work on it. And it's just really beautiful. And then it makes you think, like, oh, imagine what we could get done if we had even more people here in this room at this table, all working collaboratively and together on this project. It's just really great.
I was just wondering if the activist here could explain some techniques that works best for you, like canvassing or tabling, or what techniques have been really useful in getting out your message.
I would definitely say my style of organizing is I'm very people-centric, because I firmly believe I'm just a true organizer, community organizer at heart, and I believe there's no power like people power, that, you know, the people will always prevail over any of these things that we think we can't change. And so one of my best organizing techniques and style that I have found successful is the power of the one-on-one. And one-on-ones are basically when you sit down with community stakeholders and you have a one-on-one conversation with them, you find out what their self-interests are in their community, the things that they want to work on, and then you figure out how you both can be helpful to each other. And what that ultimately does is it builds trust and it builds rapport. And when you can build trust and you build rapport, it allows for their organization and for them to show up for you when you need them, and for you to show up for them when they need you. And so I would definitely say the power of the one-on-one meeting is one of my strongest organizing techniques.
Yeah, and as far as techniques go, I think it really depends a lot on your immediate goal too. Like, if you're just kind of trying to do general outreach, then tabling can be a really good fit. If you want to, like, turn people out to an event, maybe you phone bank. I think it really depends on your immediate goal. Yeah.
I'm going to move on to the next question. How have you incorporated social media into your work as an advocate?
I can start this one because I'm on the media team for SNAP. But I will say, even though I am on the media team and I do the Twitter, I don't really incorporate a lot of social media into my work as an advocate. I think I'm not a huge fan. I mean, it is important and someone needs to do it, and I'm glad that people do that. But I personally find it more rewarding and fruitful to find other ways to reach people and to talk to people. Yeah.
So I'm a huge advocate too, like I just said, on the face-to-face and the one-on-one, but I do think that there's power in digital organizing. And I think that we've seen electorally, that is how people have connected. But even in a global perspective, when you look back a few years to about 2013, there was an uprising in Cairo, Egypt, that happened. And it was kind of like the first uprising that we saw just globally of youth gathering and trying to overthrow like a regime. And I don't want to go too much on like a tangent, but it allowed people who were not there to follow along. And then I think when you think of major movements that we see currently, the Women's March, Black Lives Matter, Me Too, Time's Up, all of these things are through the power of digital organizing. And so I try to find out, you know, whatever the specific goal is that I'm trying to target, you know, I think it's important to come up with a way for people outside of your network to follow you. And so I've created hashtags, I've run social media campaigns, Twitter storms, social media town halls where we Facebook Live with an elected official to talk about a specific issue for people who were not there and couldn't make it. So I definitely think that there's power in digital organizing, and coming up with savvy ways that people who are not immediately next to you can follow you through the social media. It's just a plus.
Yeah, and I would totally, I mean, I would definitely 100% agree with everything that Kina said. And I would just, I guess also to go back to what Sydney said earlier, like knowing what I'm good at, like I know that I'm not really that great at doing social media, digital organizing type stuff, but I do definitely recognize like the importance of it.
But you are very good at posting social media stuff, Francis. So I don't know if they're the same thing, but you know how to do that. So
I guess, yeah.
I would say that there's always something you can contribute. No matter, so data makes me feel happy on the inside. It's like a hug or like a kind word. Data makes me feel secure in the world. So if you're someone that likes data like me, but you're not necessarily like good at taking pictures or good at like coming up with something quippy. By the way, at Caitlin1993, I have like 17 followers on Twitter. So
help her out.
yeah. Yeah, please help, because this is pathetic. So if you're, but like I was saying, if you're someone that likes data, like infographics, like making one of those are a huge deal. There was a really powerful one I saw, I think it was earlier this year, where they were showing on the United States map the number of school shootings that had happened in 2017, and it was February, and the map was filled. Like that thing went viral. So if you're good at data, maybe consider like infographics or using it to explain to people what you're trying to say.
I still think using it as a tool to kind of to really pressure intentionally people with power, social media is a wonderful tool. I mean, there's certainly examples of viral examples. The most recent one that really stands out to my mind is when the two women share their personal stories of sexual assault in the elevator with Jeff Flake, and that delayed the Kavanaugh hearing a week. Now that was a very acute viral example of social media being used as an advocate. But I think, oftentimes social media shouldn't be used to go for the viral piece. It should be used as a constant form of pressure on people. So example, in Congressional District 3 in Minnesota, I mean, all of Eric Paulson's constituents just kind of had this slow barrage of social media addressing Paulson's hypocrisies about trying to protect pre-existing conditions for people in his district, which was absolutely false. And it kind of it kind of controlled the narrative around his health policy. And he lost his seat. And I'm a firm believer that that constant pressure on social media had a big reason to do with that.
I'm really bad at social media, so I'm not going to add too much. But I have found Facebook groups to be helpful in connecting with individual people who are doing similar work, but in different regions. So to facilitate that one-on-one connection. But as for social media campaigns, I have no idea.
Right. So next question. Oftentimes the faculty and attendings that oversee our evaluations and grades have opposing views on Medicare for All and other issues. What is your experience and advice on having conversations about M4A on the wards?
I usually make a point to really focus on it every time someone doesn't have insurance, or when someone really sees the benefits of being 65 or older in this country and being on Medicare. I think that's a starting point of kind of recognizing the flaws in our health system that create grave consequences for patients. I think kind of focusing on the issue is a great inroad to start talking about Medicare. Whether you are unsure of who your audience is or just meeting someone for the first time. I guess I haven't had too many faculty or attendings that are hostile to the idea of single payer, and probably because the majority of physicians in this country support a single payer plan. I'm not answering this question at all.
I think you're doing a good job.
This is maybe where I trail off, and if someone else has a better thought. I think it can be hard to step into sources of conflict with people that are seniors on your team. But I also think at our structure of medical institutions, or as Kamara Jones would say, it's completely apolitical and ahistorical. And I think it's our role as students to really step into that and break down that structure such that we bring the history and we bring the politics into medicine. That because if we don't, the people who benefit from that are the people who are currently profiting off of our system. And so it might feel some friction. That's okay.
Yeah, I'll speak on this. I have no experience in being in the M4, whatever you guys do, good job. But I will speak on having worked in HR in a primarily male-dominated industry in tech, and working for a, not to say too much, but working for a company that didn't believe in HR and didn't believe in federal compliance. And it's super scary to speak up, especially when these people have your lives or your salary for your family in your hands. But I also encourage you to, kind of like what we talked on before, is kind of check your privilege a little bit. Like, if you are in a position that is powerful enough to speak up, if you are powerful enough to have gotten there, it is your duty to speak up. We can't play games anymore. Like, you guys have clout. You are going to be doctors. You're some of the smartest people in the country. Like, people trust you. And it's super scary. And when I would go into boards, going in front of the CEO and telling him that he needs to check it or he's going to be under federal indictment, that's really hard. I was 23 when I had to do that. But if I didn't do it, I was going to cost the jobs of 50 people, a 50-person company, so we're huge. But I was going to cost the jobs of those people, and I was in a position of privilege to speak up. So I would say that if you're in a position where you have that kind of clout, it's your job to speak up. And sometimes saying nothing is appropriate, but I would say more often than not, we operate on the basis of fear, because we want this job and we don't want to be fired or be seen as outcasts or seen as crazy advocates. But we need to fight that, because, or else this cycle is just going to continue. And we're part of the problem then.
I think that the more we speak up, the more comfortable we get doing it. So the only way to really know how to navigate these situations is to put ourselves in them. And like Caitlin said, it's difficult, but you practice and you get better at navigating them.
I also would just like to add that speaking up and speaking out is an act of accountability. And like, an act of accountability is not just resistance, it's love, right? Like, that's love for your community. When you hold folks accountable and people see you have the courage to speak up, it also gives other people the permission to have the courage to speak up as well. And those are very difficult lessons, but those are the times that you're stretched the most as an organizer or somebody who's an advocate for a particular issue. So, you know, just look at it as that way. It's not just being defiant or resistant, but it's another form of saying, I love you to the people that you're advocating on behalf of.
That was beautiful.
Yeah.
Yeah.
Yeah, that's pretty good.
I just typed that down in the Word doc because I'm gonna clean this sometime in the future. Hesitance is in a way a privilege, and I think it's good to kind of sit in self-reflection. I think about last summer when I saw a lot of people organizing around, but it wasn't necessarily single payer, but protecting the ACA over the summer. And I felt myself distancing myself from that because I had other things that I was working on, and realizing I could distance myself and I could hesitate from speaking up or speaking out, as King was talking about, because I didn't directly feel affected by some of the crap bills that were being dumped on America, which spoke to how insulated I was as a white male in this country. And being able to sit with that. And I think one way to really digest some of that is speaking that out loud and speaking those hesitations with people with different life experiences than you that don't look like you, who are close confidants and comrades in this very large fight that's going to take a lot of people, such that we can all kind of break down our insulations wherever they are and act together. Whether that's on the wards or whether that's with your best people around you.
I think I'm gonna move to the last question, which is, what does self-care look like for an advocate, and how does this differ from traditional self-care techniques? What techniques have you used to avoid burnout?
So I'll start. I would definitely say that one of the things that I've learned in my organizing and my advocacy work is that some of these spaces are very toxic. They can be extremely toxic when people exert their privilege, when they don't listen to you, and also just your ability to what you will and will not accept. So I think that a form of self-care that I've taken in organizing efforts, and it's the most efficient and effective for me, is setting my boundaries. Understanding what my yes is and what my no in certain situations are. I think that it's easy for us to be so passionate about something, get into a group or organization, an advocacy organization, and just have everyone pile their work on top of you while other people are not pulling their weight. And you'll get a guilty feeling like, okay, I have to do this because it's important to me. But you cannot serve people. You cannot be a good organizer if you're pouring from an empty cup. So one way for you to exert self-care is to set your boundaries, make sure that you're holding other people accountable in your group, that they're pulling their weight as well. And also, please, please, please ask for help when you need it. That was a big problem I had when I first started out organizing. It was like a superwoman syndrome where I felt like I could do it all. And I couldn't. And so once I got to the place where I was setting very healthy boundaries for people who I worked with, and I also learned to ask for help, was when I really started to prosper in this work, and it improved my health a lot because it took the stress off of me.
Yeah, I can speak on this a little bit. I would just add that I feel like it's an act of self-care to be like keeping an eye out for your teammates and your comrades and your people who are fighting alongside you, and be really proactive about being like, hey, how are you doing? Like, are you okay? Do you need, can I take anything off your plate? Like, can I do anything for you? And even if I feel like better to err on the side of like being kind of a busybody than being like too distant. Because I think when you're building those relationships proactively in that way and you're building that network, then you know that they're going to have your back. And so that's like a kind of proactive self-care, I feel like.
So I'm going to move into advocacy tips and how-tos. I believe Francis has the first slide on op-ed and letter writing?
Yeah. So op-eds and letter writing. There's some really great tips here on the slide. The font is really small, so I'm going to get really close to my computer. But so you want to be really conscientious about length, definitely on the shorter side for op-eds, and then shorter, of course, for letters to the editor. You can usually find a word limit, depending on where you want to submit. You can look and see what the word limit is for wherever you're trying to submit to. If it's a letter to the editor, it's probably going to be a response to an article that has recently appeared in the publication, or and then in either case, letter to the editor or an op-ed, it should be very topical. One thing that like if you're planning an action of some kind, like if you plan a rally or sit-in or whatever, some kind of action, something that you can do is like that day, as soon as you finish the action, is write up a little 200-word letter to the editor about how it went and submit it, so that you can kind of get some media attention after the fact. For some general tips, you do want to be very clear. You want to have a single point that you're focused on, and to that end, PNHP has great resources of folks who can edit your op-ed and edit your letter to the editor and help you figure out how to or where to get it placed. So definitely don't hesitate to take advantage of those resources, because it's very, very, very helpful. Dixon and Claire both are amazing editors and have a lot of experience, and it's really, really helpful. And then these last points on submitting. Yeah, contact Dixon and Claire. Put your op-ed in the body of the email rather than as an attachment. You want to make it as easy as possible for whoever's making that decision to get a sense of what you're about. And especially if it's something topical, they might be getting dozens of emails with different op-eds and letters to the editor on that topic. So you want to just make it as easy as possible for them to say yes. And you can follow up within a week if you haven't heard back. And then down there at the bottom, you can see of the slide, you can see more tips and suggestions. So there's, like I said, resources on the PNHP website on how to write an op-ed or letters to the editor. To sum up, I feel like the most important things are definitely take advantage of the resources that exist within SNAP and within PNHP. And be as clear and succinct as you possibly can, and be as topical as you can. So get it in as quickly as you possibly can.
Okay. Does the panelists want to discuss contacting your elected officials? Also, I would like to say that this could also be applied to contacting local newspaper editorial board. I think the same techniques apply. Dear ones.
Can I ask a quick question before we move to that?
Sure.
Hi, this is Bradley. I'm a first-year medical student at UCSF. And on the topic of letter writing, I was wondering if there are any sort of skeleton outlines or other boilerplate materials that would make it easy for a busy medical student to sort of whip up one of these letters to the editor. And if not, can we make one? Thanks.
So to my knowledge, those don't currently exist, although I feel like they have existed in some form in the past for particular events. Like I think last year for the SNAP conference, we wrote up an op-ed template for students that they could use after the conference. I think that's a good idea, but might be a little tricky just because it is so important that the op-ed or letter to the editor remains very topical and pointed, or as much as possible. But I think that's a good idea. And the other panelists might also know better than I if that does exist somewhere and I'm not aware of it.
Yeah, I think it can be a little tricky just with things about op-eds and LT. One central component of it is that you want some sort of news hook or some relevancy that would make an editor reading through this to kind of insert it into a larger narrative of the news of the day. But that said, there certainly are kind of data points of what single payer looks like in the United States, what it would look like, and to give you kind of that information that backs up your argument that you make. We do have those that you can kind of populate your text, whether it's 200 words or 750 words. You'll certainly want that to be part of the piece.
Great.
I know
I think that would be super helpful.
Yeah.
Go ahead.
We can send you. No, that's a really good question. We can send you a link and also kind of highlight that on the PNHP and SNAP websites as well for you, Bradley. Thanks for asking.
Great, because I know that's one of the actions this week, and that was a question for me, because certainly whatever you're writing should be context specific and maybe even tied to an event that you had run, but having a bit of boilerplate about, like, this is what it means for cost savings for taxpayers. Here's what it means for coverage for all folks in America. Here's what it means for busy doctors. Like, those sorts of things that will probably be pertinent in whatever letter you're writing, kind of almost pre-written statements, would be really awesome to help to slot in that you can then craft your narrative around.
And no, those are perfect points of how do you kind of structure your central portion and then make it relevant today. I would say, as you're writing this week and next week, the easy news hook is that new Congress, new health system. We have a wave of new people that are supporting Medicare for all in the House, especially if one of those newly elected representatives is either supportive or considered on the brink of supporting. That's a perfect hook, especially as we're shifting into the 116th Congress, I think. So just a thought for this week.
Also, Bradley, right? If you go to the PNHP website, pnhp.org, under member resources, materials and handouts, and you can find fact sheets there. And you can just plug in that info.
Thank you.
Contacting. Did any panelists want to discuss contacting your elected officials?
I would just say if you are able to arrange a legislative visit where you go and talk to your elected official or your elected official's staff person. This is something that came up when I went to one of the workshops at the meeting this weekend, and the speaker said this, and I thought it was really smart and pointed, which was basically just like, when you go in there, you can't just have like a few talking points and a general like, hey, support single payer. You should look like you're plugged into a plan and you're plugged into a strategy, and you should look like a threat to their power. And the part of doing that is looking like you are part of a mass movement that is demanding single payer. And that might be saying like, hey, I'm part of this organization. We have, like XYZ dues paying members across the country of like, thousands and thousands of physicians and medical students. Or whatever the local landscape of health justice looks like in your community. But I think that's really important, like, because you can sit there and like say your piece and they'll be like, okay, yeah, sure, maybe someday. But if you really look like you're organized and you're part of a strategic movement to win single payer, then it'll be much more effective use of your time.
Okay. So
I think also with contacting your elected officials, this is kind of where you, I feel like you're more likely to get a meeting with your actual official, and meetings with staffers are wonderful too. But if you're very clear cut in your role in the community and what you hope to talk about. So I would say the more details even there. So mention that you're a medical student. Mention that you've been involved in local advocacy on various health justice topics. And then when so that's for setting up a meeting. If you're calling with a specific question, always ask for an answer. So if you're calling about someone to support HR 676 or one of the Medicare for All bills, always asking, great, that's wonderful that you're passing that information on to the Congresswoman. Can you please get back to me with her response? And because then you have a data set and information from them to go off on, so that when your chapter or your next posse goes for a bird dogging event, you have some information to go off of to further ask them more specific questions.
So quickly, I'm just going to point out that if you need contact information, it's in the PowerPoint presentation. Setting up a visit, you should call your district office and speak to the person that handles the legislator's schedule. Meetings should not last more than an hour. Be persistent with the staff member. After scheduling, send a confirmation letter. And then preparing for the visit, everyone attending should research the representative, make an agenda and goals, emphasize why your opinion would be of benefit to the local constituents in your district. During the meeting, it's important to focus on building a relationship and ask for specific action. And I think it's very important to ask for his or her position towards the end and provide affirmation when possible. And then follow up with a thank you to your legislator. And then for more information, oh, sorry.
No, go ahead, Rebecca.
And then for more information, you can go to the PNHP website. The link is on the bottom of the slide.
I just want to ask if your legislator already supports whatever single payer bill is relevant to them, whether it's the state or national one. You can still meet with them and ask them to more publicly support the bill or encourage their other colleagues to sponsor the bill if they haven't.
Yeah, that's important. Thanks. And then for more information on bird dogging, SNAP just hosted a webinar, Facing Our Foes, Bird Dogging 101. And then the link is also there. And then I think, does somebody want to talk about organizing a rally?
I wonder if Caitlin or Tina could speak to the recent organizing in San Diego.
Yeah, I'll speak on that. So there's a few things that you want to just consider if you're going to organize a rally. Sometimes they're spur of the moment. Ours was a pre-planned rally, but actually the night before we had our rally, Indivisible San Diego was hosting a rally against the Trump administration, which literally was something that they put together in 24 hours. So it's always important to consider current events, what's happening, and then who you want to invite to the rally. So something that I always do whenever I plan the rally is I look at the location that I'm at, and I try to bring in as many community stakeholders in that particular area or location as possible. So even though we had our annual meeting in San Diego and we're like a national nonprofit, I did want to go ahead and bring in groups like Border Angels and Women's March San Diego and Indivisible because they've been doing work on the ground. Of course, Caitlin did an amazing job with getting in touch with Border Dreamers. So we knew that San Diego was a heavily immigrant community, so we wanted to pay respect and to that. And we also wanted to give the microphone to natives of San Diego to speak on behalf of their community. So be cognizant of who you're inviting to be speakers. I'm sorry, guys. I'm getting some feedback, so if people can like mute their mics, I think I feel like I can. Other than that, I would definitely say you want to stay organized and create a checklist of things that you may need the day of the rally. So you may need a sound system. If you don't have a sound system or the sound system breaks down, do you have bullhorns so people can speak and get their message out? Those were things that we consider. You also want to consider if the area in which you're hosting the rally needs a permit, because the police did arrive. You guys didn't see it, but they did arrive and they did ask for a permit so that we can continue the rally. Some places are public places, so they won't require that. But most places and parks do require permits if you have a certain amount of people. So you always want to make sure that the logistics are squared away. And the logistics includes checklists of everything that you need, your sound system, your permits. And then you also want to make sure that anybody who's helping with the rally has a run through of the show. So you want to create a minute by minute kind of one pager of how the event is going to run. And you want to make sure that you stick to that, because whatever time you put on your permit is the time that your rally wants to be over. It has to be over. And so you want to make sure you give people ample amount of time to speak and also kind of congregate before dispersal. So you want to make sure you have a run through of the show. Also, another thing that we did was we did contact the San Diego Police Department to just let them know that we would be in the area, just in the event that, you know, multiple people started calling the police because they didn't know what was going on. We wanted to make sure that we got in contact with them first. Let me see if we're missing anything. And also, you want to make sure that you touch base with the speakers ahead of time to confirm them and make sure that they're coming, but also to give them an idea about what they're going to be speaking about. And you also want to check in with them to make sure that their talking points are aligned with the messaging that you want to send out for that particular rally. After that, I would definitely say it's just coalition building, making sure you publicize the event on social media, that you're sending out email blasts, and that whoever you're partnering with, whichever organizations, that they're also sending out information as well. So that, and you want to contact the media to make sure they come out and cover whatever you're doing in the rally. So make sure you write a great press release, invite as much media as possible, invite as many community partners and community members as possible, and then also just make sure that all of your logistics are checked off.
Sydney, did you want to talk about moving forward beyond the week of action and organizing an event for your chapter? And I'm going to give you like a minute because, yeah, sorry.
Kina already covered a lot of this, but focusing on sort of the campus level, you want to pick a date and time that works for the exam schedules of all the classes in different colleges at your school. Coordinate with your speakers in advance. We try to do around a month for faculty doing a lunch talk, but you would need to give it even more time, a few months, 6 months, if you want the event to be on weekends or holiday, or if you have speakers traveling from out of the area. As Kina said, make sure that you connect with the speakers and find out that their talking points are aligned with your goals for the event. For incentivizing students to come, you definitely want food at the event. For big events with outside speakers, you can connect with faculty members and try to get them required for classes. We had Dr. Steffi Woolhandler last year, and her talk was required for one of the electives. And you can also advertise to faculty, so through connections with key faculty members, or sometimes they have mailing lists for the faculty at your school. And everything else is on the slide. Yeah, 9 o'clock, exactly.
Awesome.
Okay, so I will look at the chat and see if there are questions from the audience quickly, since this should be wrapped up soon. Let's see.
I've seen a couple of back from the Medicare for All conversations in Bruce and Peter about bringing up Medicare for All topics in the rounding setting. Yeah, I think it can be, that's a challenge. I don't think I have a good answer to that one. I think considering like any other management plan that you offer medical care, kind of hearing a little bit of an echo if people have their mics on.
Sorry.
And I mean, think about anytime you talk about thinking about how to create next steps for someone's care alongside a patient, and you kind of back up your reasoning. And I guess I kind of see it in the same vein as if you were to offer a prescription for a certain medication, you're going to give a reasoning why. Such as we as SNAP are offering a prescription for our health system. And we have a lot of data, we have a lot of patient stories. We ourselves have personal interests about wanting to practice in a system that isn't dominated by private insurers that dictate what can and what cannot be done in the health system. So yeah, that's a tough one, but maybe that's a different way to look about having those conversations.
I think also being conscious of which specialties are more receptive to Medicare for All is helpful when you're just starting to talk about it, or you're talking about it with doctors who you don't really know yet. So family med, pediatricians, I've also heard nephrologists are more open to it because they deal with dialysis patients compared to, ortho and surgeons. Not to generalize, but
no, I'm trying to remember which study looked at specialty specific. But that's a good point too. I mean, if you're on a nephrology rotation, I mean, you could pull in bring up the question. Don't you think it's kind of weird that we cover dialysis in this country, but we don't necessarily cover a comprehensive blood pressure medications for everyone? But we cover dialysis. And using that as a starting point for a conversation about our health system.
Yeah, I would also, I mean, every specific situation is different, but I feel like you can get away with a lot by just having like a huge smile on your face and being really confident about it, and people will just like, oh, okay, yeah, Medicare for all. So.
And it is amazing how there's a lot of times that I feel as the educator on my inpatient teams about health systems and single payer. I think because SNAP does such a good job of providing this information for students, because we don't get any of it in our standard curriculum. And unless if that doc is also a member of PNHP, that's been fun, where you just get to have a really rich conversation on the wards. But oftentimes, I think people are receptive if you insert yourself as kind of a person with some knowledge on the topic, and mention that you're a member of SNAP.
And I would impart to you all, I mean, I'm not a doctor, so I'm not necessarily the most educated. Yeah, I'm not a doctor, I just play one. So I'm not necessarily the most educated when it comes to the power structures you all have to deal with on a day-to-day basis. However, I would say that consider your role as a healthcare provider and how you give advice daily to people on what they should do for their health. So why is their health care so taboo? And just let that kind of sit in the back of your mind. Why is this a conversation you're not allowed to have? You have the knowledge and the expertise, the research, and you're not trying to sell them anything. You're trying to help them be healthy, and being healthy means you can afford your health care, and a lot of people can't. So you sitting there and telling your patients or whoever you're talking to about these options that are available to them, if it were to pass, if Medicare for All were to pass, it's almost your duty. I don't know if you swear it in the Hippocratic something, but sounds good. So just consider that.
Nice.
Okay. I think I'm gonna wrap this up. Anyone else? But thank you all for joining and for giving your insight. It's very educational. I learned a lot, even as I'm going into my second year being a SNAP leader. So thank you all so much, and gonna call it a night.